So welcome to all who are here to the Office of Research Administration's seminar series. David's unable to be here today, but he sends his apologies. And as it is, you're stuck with me and I'll do my best to fill his shoes. Before we begin, just a little housekeeping. Please use the Q&A feature in Zoom to ask questions during today's presentation. We'll be sure to save some time at the end to make sure all of your questions get addressed and answered. And without further ado, it's my distinct pleasure to introduce today's speaker, Dr. Denese Neu. Dr. Neu is an engagement officer at the Patient-Centered Outcomes Research Institute. She acts as a liaison between the engagement and science teams to help manage the organization's research portfolio and provides technical assistance on the practice of engagement. Before joining PCORI, her previous work focused on the intersection of social policy, health, and community development. Through this work, she's gained experience with a range of patient populations, social determinants of health, and healthcare system issues. She has direct experience as a caseworker, program manager, and health administrator before earning her doctorate. And she's served as a consultant for a variety of organizations, including the Robert Wood Johnson Foundation. She's a social scientist with a PhD in urban studies from the University of New Orleans. And welcome, Dr. Neu. I now turn the floor over to you.
Great, thank you for the introduction. Hi, everyone. One of the things that I hate about the virtual world is that I can't see you. There's something about being in the room and seeing faces and the reactions that we miss from this virtual space. But I'm going to pretend like you're all sitting there in front of me, smiling and eager to learn and get to know a little bit more about PCORI. I designed the presentation today to hopefully fill in, provide information to people who are already familiar with PCORI, as well as those of you who know nothing about PCORI, have never heard of us before, and to also provide information to a range of audience, the researchers who are seeking funding, to the students who might be interested in getting involved in this type of research, as well as any community partners who are in attendance today. So these are the objectives for today. I want to give you a brief introduction to PCORI and our approach to research, the what, why, and how of engagement. This is something that is very new to a lot of researchers. Engagement isn't necessarily new to community partners, though. So it's just, how do we start bridging these different worlds, the lived experience with the research and the rigors of science? And then share with you some of our funding opportunities and where to get more information. And then also ways to get involved with PCORI, whether or not you are a funded researcher or involved in one of our studies or engagement awards. And then it will open it up to Q&A afterwards at the end. So real quick about PCORI. We are an independent research institute authorized by Congress in 2010. We're governed by a 21-member board of governors representing the entire healthcare community. That includes patients and stakeholders, not just researchers and physicians. We fund comparative clinical effectiveness research, also known as CER, and that engages patients and other stakeholders throughout the research process. I'll explain CER in a little bit more in depth in a future slide. And then we seek answers for real world questions about what works best for patients based on their circumstances and concern. That's what we mean by PCOR, Patient-Centered Outcomes Research. It's a type of CER. Patient-Centered Outcomes Research Institute. The purpose of our institute, when we were authorized, was to help inform decision making and the decision makers. So this is we are funded for the purpose of assisting patients, clinicians, purchasers, policymakers in advancing the quality and relevance of evidence. And then also we are charged with helping move that evidence more quickly out into communities so that way it's useful and it's usable. It's not usable if it's sitting in a journal on a shelf for 17 years before somebody else finds it. And so one of our charge is to make sure that we get it out into the community and in a way that it is easily understood and used by the people who need it. How is our research different? PCORI funds comparative effectiveness research. And what that means is we weigh the benefits and harms of at least two different methods of comparing, preventing, diagnosing, or treating a clinical condition to improve care delivery. So basically what that means is this has been proven to work, this has been proven to work. Might one of these actually work better? And might one of them work better for a certain population of the patient population? So this is where you can start answering or asking questions about the delivery of care and a particular treatment for rural patients versus urban patients. So that's just one example. We aim to produce evidence that can easily be applied in real world settings. We don't create a research office where patients need to go. This is where patients receive their care. This is how patients live their life. And so can those treatments and that evidence be integrated into the way we live our lives as patients, or the way we receive care, or the way a clinician delivers care? And we focus on answering questions most important to the patients and the people who care for them. How do we do that? We do that through the engagement process by engaging patients, caregivers, clinicians, insurers, employees, et cetera, throughout the entire research process. So on this screen, this is a schematic of how PCORI does that engagement process. So we don't just have an expectation of engagement within our awards. We do engagement ourselves. We bring these different stakeholders to our table to help us as decision makers, to help other people out there in the world who are decision makers around health. So just to kind of walk you through this real quick, there's the capacity building. There's research priorities. We are currently in the process of updating our own national priorities with a multitude of different stakeholders helping us do that. The funding and conduct of research, we bring people to the table. The merit review panels are not just staffed by researchers, but we also bring patients and stakeholders to be service reviewers on the merit review teams. And then there's also the dissemination and implementation process, and interacting and engaging with policymakers. So real quick, this is kind of what you just saw. This is kind of that output, the number of people, organizations that we have involved in a multitude of ways in our own engagement processes, because we believe that in order to change the culture of research, we have to have an inclusive research environment, and we have to walk the walk ourselves. So this is some of the commitments plan for the next 3 years. These are the buckets of funding. We are planning on deploying an average of more than $500 million per year. And I'll get more into some of these buckets and the different funding mechanisms shortly. But I'm going to give y'all a minute to just quickly take a look at it, scan this slide, make any notes that you might have. So that way, when we get to the Q&A, you can ask those questions. So moving on to the what, why, and how of engagement. A lot of researchers who are new to this concept of engagement, to engagement in health research. It's what is it? What does it look like? Why should we do it? How do we do it? And so this slide, just real quick, goes over the difference between patient-centeredness and the stakeholder engagement. Each of these are different. Both of them are very, very important in the work of PCORI and PCORI funded work. So patient-centeredness, that is core to our mission. It is part of our name. And what that basically means is that it addresses outcomes, both the benefits and harms that are important to patients. The interventions that are proposed for comparison are currently available to patients. So that means that is something that's already out there in practice. It's not patient-centered if it's experimental. at least that's, how we frame patient-centeredness, that this must be available and ready for patients. And then the study designs are low burden to participants. So rather than tacking on a lot of work for patients to participate in a study, we make it easy for patients to participate in the study. So that way we really are truly getting more useful and usable evidence for them. So think of patient-centeredness as a goal, and then this patient and stakeholder engagement process sort of as the mechanism to help achieve that goal. And when we talk about engagement, we mean that patient and stakeholders come to the table as partners in research, not just subjects. So you'll still have subjects. If you're doing a research study that's funded by us, you'll still have the subjects, the participants in the study, but you'll also be expected to invite key stakeholders and patients to the research table as advisors and partners on your team. This can happen by building existing relationships or even going out into the community to build new ones. If this is the College of Public Health, so I know that you're already working with a lot of community partners probably. So it's about leveraging the expertise of the people who you are already having developed relationships with and bringing them to the table to improve the study design and conduct of the studies. And the way in which we have learned that that is done is that there's a range of engagement approaches, and that's input, consultation, collaboration, and shared leadership. Each of these are different, and one does not necessarily mean one's better than the other. It's a matter of picking the right one for the right thing that you're trying to accomplish. This slide will kind of gives you an idea of that continuum of the engagement practices that I just named, but then the level of that partnership decision-making authority within the study design and implementation, and some examples across the bottom. So for example, if you're very early in developing a research agenda and you know that you want to have patient-centered research question, you might want to, but you're not sure what that is. You might want to do a focus group or some crowdsourcing around that, bringing the different partners and patients to the table to kind of bounce around. Here's what we think or how we understand the problem. Are we there? Help us get to the best patient-centered questions and help us identify the types of outcomes that matter to you and how we might measure those. So that might be the early input before you even start looking at designing and developing an application. Once you get into the application process, you might decide that, yeah, you have a patient co-PI that you want to be right there along with you as a decision maker throughout the study. So there's this continuum, and there's a lot more resources that you can access at PCORI.org. On learning more about each of these. So there's always the question, does engagement actually make a difference? PCORI is a learning institute, so we embarked upon the journey to answer that question. We call it the science of engagement. We've done literature reviews, we've done evaluation and analysis of our large portfolio of almost 700 funded studies. And we are constantly learning about methods and techniques from our awardees. These are themes that have emerged that demonstrate that engagement has indeed made a difference in the way research is done. And the link at the bottom is to an article in Health Affairs from 2019. Where we did a full lit review of lessons from the field. And these are ways that we found that engagement has made a difference. User orientation and acceptability, meaning patients are saying, yes, this study is acceptable to me. As you know, there's a lot of mistrust and distrust of science. And if a study is not acceptable, you're going to have a hard time recruiting patients and getting the support of the patient population or the clinician population in being able to conduct that study. The feasibility of the study. We have found that engagement has helped with the feasibility of the study, meaning this can be done in real world settings. An example is clinicians or administrators working at a federally qualified healthcare center. They might say great research question, very much patient-centered, very much answers a question that we really want answers to. But in order for you to carry out this research in the real world setting, this is how it needs to be done in this setting. These are our operations. So here's information that can be helpful to you to tweak and more easily integrate that study into where the work of patient care takes place. Study quality. There has been concerns that that does engagement decrease study quality? We have found that when it's done well, it doesn't. The rigors of science are still upheld, and bringing that marriage of science with lived experience, it's not always easy, but that's the engagement process. But study rigor remains there, because if the study does not remain rigorous, we all know that you end up with a bunch of data, but not necessarily evidence that's going to pass the sniff test of science. So it's finding that very careful balance. But engagement has also helped with the comprehensiveness of study, of identifying other sub-questions to answer, and also the materials and the products that come out of a study, and the translation of them for people to receive the information and put it into practice. Relevance. This study matters. It is important to the decision-making process. And then also, oops, sorry about that. It has also engagement has actually engaged, or has actually informed the engagement scope and quality of engagement. So this is our own learning processes, what is effective versus what is just something that checks the box. And how also do we help stakeholders be well equipped before when they come to the table as partners on research. So this is the engagement rubric overview. I just want to point out this is a resource available to you to help you start thinking through if you want to do PCORI CER. And this is kind of the engagement throughout the phases of a study. And then at the bottom are the PCORI principles of just kind of, these are the types of values that you are going to bring to the table yourself as a researcher when you invite these partners to your research table. I just want to make a point that the engagement rubric, we are getting ready from our own learning to embark upon the journey of updating this, but this does not mean that it's outmoded. This is still very helpful information for any researcher who's starting to think about doing engagement within a research study and applying for PCORI funding. Lastly, as part of our own learning about engagement, we have developed some very large tools. Research fundamentals, it is available now. We recognize the need for non-scientist partners in science to have some foundational knowledge in PCORI and CER. So we developed this tool. It is free, publicly available. You can use it whether you are involved with PCORI or not. It's written and developed at a lay audience level, but it's also really helpful. I mean, I have a doctorate. When I watched it the first time, I learned things. I found, it just kind of really puts things into simple, easy to understand terms. So it's an excellent tool for students, for educators, for researchers, as well as the partners. And then we are also in the process of developing this very large, robust, dynamic toolkit called Building Effective Multi-Stakeholder Teams, research teams. And so this is going to be a searchable. So those things that you're kind of struggling with or you need to learn more about, you can go in there and you can get that information. It's coming out in the spring. We are hoping April. We're shooting for that. So, put that on your notes as something that is on the horizon and will be available to researchers and partners as a tool to make this work a little bit easier, because engagement is not always easy, and we'd be lying if we said it was. And so now I'll switch to the funding opportunities. So this is the 2021 Research Award funding opportunities. And so as you can see, they're kind of these are the research awards, not the engagement awards, which I'll discuss shortly. So, kind of what I recommend you do is take a look at each of these, go on our website, learn more about the one that you think fits your research agenda the best. And then when the funding announcements are made, we call them PFAs, PCORI funding announcements, sign up and attend one of the town halls. At the town hall, PCORI staff will walk you through, the attendees through what we are asking for in a funding application, the type of information that you should provide in a successful LOI and subsequently a successful application. It gives you an opportunity to hear more about our priorities and also some live Q&A with the PCORI staff before you start writing your research, your research application. And then these are some of the things that are new for Cycle 1, 2021, special areas of emphasis, which I think are very appropriate for a College of Public Health: maternal mortality and morbidity, intellectual and/or developmental disabilities, and then obviously COVID-19. I'll stop a second, let you read through that. Take some notes. And lastly, with COVID-19, I want to make you aware of a resource that is out there. We supported the development of a registry of healthcare workers around COVID-19. And when I pulled this screenshot on Wednesday, there were more than 22,000 healthcare workers who have signed up for the registry and said, yes, we are interested in participating in research around COVID-19. So if that's something that's your research agenda, workforce and COVID-19, this is a resource for you and make it a lot easier to do recruitment. So switching a little bit to the Engagement Award Program, this is a little bit different than our research awards. Actually, it's very different than our research awards, in that the funding is to support engagement in and with research. It is not to conduct research. So this is not a mechanism for community-based participatory research. You might, a CBPR researcher might actually, be somebody who's doing engagement and use some of that methods for the engagement, but it really focuses on the engagement. And the goals of these awards is to build a community of patients and other stakeholders that are well equipped to participate as partners in PCORI CER, and then also helping to build so building a pipeline for PCORI and CER, but also those pathways and the gateways to move our evidence out into the community more quickly. This is a snapshot of our funding opportunities. We have 3 different ones under the Engagement Awards: capacity building, dissemination initiative, and the stakeholder convening support. Each of these different. So again, I recommend, if this is something that you're interested in, go ahead, and I don't know how to get rid of that little thing at the top. So what I recommend is that if you're interested in one of these or you're not sure which one, go to the PCORI website and you can explore each, get more information about each one of them. The letter of inquiry is due April 1st. I want to just say, do not panic if you're not ready by April 1st, because this isn't just a once a year funding. You'll be able to apply later, subsequent funding. I think we have three different times a year. I think, I could be wrong. But what I also want to draw your attention to, hang on a second. We do also have the special cycle funding with these engagement awards, one that is focused on the intellectual and developmental disabilities, as well as topics related to COVID-19 and the engagement processes around that. This is what I want to suggest you take some time. I want to draw your attention to this, to learn more about each of these funding mechanisms and hear from the directors of each of these departments. Go to this link. This is new, hot off the presses. This is the latest detail and information we have for the public and the interested researchers. So it was recorded, as you can see, February 2nd. So it's the newest information. It's about 30 minutes long, and you'll get a lot more detailed information about each of the funding mechanisms to help you determine which one do you go to, which one might be right for what you're thinking about studying or doing with community partners. So now I want to switch to getting involved with PCORI. There are ways to be involved with us beyond just funding. Again, I draw your attention to that schematic of how we engage people in our decision-making processes. Currently, we have advisory panel openings. The applications are due March 31st. So if this is something that you'd be interested in, I encourage you to take a look. We are recruiting people for each of our advisory panels, which are listed here. And there is a link for you to go to learn more about them. Some other select PCORI engagement opportunities, the call for merit reviewers. All of our application processes, we go through merit review, and we involve patients and stakeholders as merit reviewers, not just researchers, on those panels. And while we have a lot of merit reviewers who come back with each cycle, we're also looking for new people because new people bring new perspectives. And help us kind of refresh our own processes around the merit review. We are also always looking for merit reviewers with certain expertise around, whether it be population or the topic of study. So if you're interested in doing something like that, it's a great learning opportunity. It's a great way to, apply your practice, your practical skills, as well as your expertise. I actually got involved with PCORI originally as a merit reviewer as a stakeholder on the Addressing Disparities merit review panel. So it's a great exercise. It's a great learning opportunity. It's a great professional development opportunity. So if you're interested, go ahead, put in the application. And might be a delay before you're selected and invited to participate in a panel. But again, I highly recommend it for anyone. And then also the Ambassador Program. This is a national volunteer network of patients and stakeholders and researchers aiming to shift the culture of health research to be more patient-centered. So if this is something that you really feel strongly about and it's something that you want to do, this is an opportunity for you. And just a little bit more in-depth information about our PCORI Ambassador Program with the Ambassador Center. It's a great place to network. There's resources available to you. We do coffee chats, which I think are about 20 minutes where you can pop in at lunchtime and network and learn from other people who are doing this work out there in the field. It's a very diverse group of people, everything from patients who, never went to college and they became partners on studies, and, even served on our advisory panels, to the researchers who really, have embraced the value and benefit of having patient partners at the research table. It's easy to join, doesn't come with an honorarium, so sorry for the students there. But again, it's a great networking opportunity for students who might be interested in doing this kind of work. And then lastly, just want to share some information about our annual meeting. And I wish I could get rid of that bar at the top. And the annual meeting, this past year, we had to go virtual like everybody else because we are living in a time of a pandemic. But the nice thing about it was we were able to reach a lot more people. We had the highest attendee rate we've ever had before. Our annual meeting is free. And so what we did, we also took that virtual meeting and we did the recordings. And so now all of this is available to people on demand. So if you're a researcher just stepping into this right now, you could go in there, you can listen to some of the panels, hear directly from researchers and their patient partners about this type of work. If you're students, this is great educational opportunity outside of the classroom. And then also want to point out to save the dates for our annual meeting this year, which is again going to be virtual because we don't know what's on the horizon. So we've decided let's just plan for it virtually. And this is something, again, it's free and it's an excellent opportunity for those of you who are students who might not have the funding to attend a conference, the travel and the hotel and all the expenses that come with it. Of course, nothing replaces that live and in-person opportunity for the networking and learning, but we want to make sure that this is available to everybody because while, you know, the pandemic goes on, the work goes on, and the learning must go on. So on that note, here is my personal information, contact information. And I'm going to now open it up for Q&A. And I think I can stop sharing the screen now. Is that?
Sure.
There we
go. Thank you so much. That was fantastic. Thank you very much. We do have some questions that came up into the Q&A. Dr. Bass asks, do all types of research awards require you comparing two evidence-based studies? If so, how will that work with COVID?
Oh, that's a great question. So yeah, that's one of the I guess, wow. Okay. I wish I'd had that question in advance so that I could answer it a little bit better. We did do a targeted PFA on COVID. I'm trying to pull from my immediate brain right now of what some of those studies look like. So for example, one is with the homeless population, and the comparators are the utilization of an intervention program around unhoused people and some of the supports, and whether or not there's a different effect in helping to reduce the spread of COVID among that population. Another one that I'm immediately familiar with is issues around trust and the COVID intervention, particularly vaccine, but how to work with minority populations and bringing in community partners as an intervention to help with the COVID epidemic. So that's not, yeah, I understand the confusion there, and I'm actually kind of like, wow, I need to spend a little bit of time of how to explain that and decrease that mismatch between how we talk about CER and then the issues associated with COVID-19. There are some COVID-19 contracts that are currently out there. PCORI's website, we are incredibly transparent, a funder. So you can go on our website, you can plug in COVID-19, and you can draw up those studies that are currently gearing up, that are underway, and learn more about what has been proposed and how that work is designed.
Thank you.
I hope that was clear enough. That was a hard question for the first one.
Can you talk a little bit more, and we have other questions. This one actually is mine. I'm going to usurp the line right now. Can you talk a little bit more about the contract? So this is really different than a grant you might get from the NIH or some other funder. It's a contract form. So you'd mentioned it, and I figured this would be a nice time to just follow up on that.
Yes, and this is why we call people awardees versus grantees. So when you receive an award, you're working closely with PCORI staff. We're not a sponsor, so we're not going to tell you how to do your work, but we're going to kind of help you resolve some of those problems and give some of that technical assistance along the way. So for example, the engagement officer, we provide technical assistance in the early phases of, helping you think about your engagement activity. The other thing with the contracting is that there are milestones that throughout the award, there are milestones and reporting mechanisms along the way, and that, when a study or an award starts to show some problems or challenges, then, where it's kind of an earlier intervention, versus that at the end of the grant, here's why we didn't succeed. It's, hey, we're struggling right now. It's being reported in this milestone. And then it's, that making the adjustments, contract modifications if necessary.
Thank you. Michael Harvey asks, do you consider proposals for international research or research that happens across borders, US, Mexico, for example?
Yes, they tend to be a little rare, and that what you need to be doing is making sure that it has a benefit to US population. So we do have some partnerships or some cross-border projects. I know that there's one up in Canada. There's one where part of the research team is, I believe, in Sweden, another one partnering with a research team in Italy. But again, this must be something that is available to patients and will benefit patients in the United States. So as long as you can provide that convincing and compelling case, then it would not be excluded or necessarily automatically excluded.
Thank you. Sarah Bass asks another question. Can you define what you would accept as evidence-based interventions for the CER? And if you did an intervention through some other funding mechanism and had outcome data, does that count as, for one of those comparators?
Okay, so I heard two different questions there, and I want to make sure that I'm hearing the questions correctly. So there was a funding mechanism that proved the efficacy of one of the comparators.
Yes.
And now they're thinking about applying for a PCORI research award that comparator to this comparator.
That's how I read the question.
Okay. So that would be fine. I mean, you have to prove efficacy in order to say I'm doing this comparative study of these different interventions. Oh my gosh, interventions are so broad. I mean, it can be, 2 medicines versus 3 medicines, which works better, which one is a preference for patients, which is more disruptive. Another example might be, occupational therapy for pain, lower back pain alone versus occupational therapy combined with cognitive behavioral therapy. So and then we also have hearing loss. Is there better outcomes or preference associated with, having bilateral hearing aids versus only one because of the great expense of a hearing aid? So it really runs a broad range, it runs the gamut. And so what I do recommend is, based on what your study topic is and the patient population that you're working with, go into PCORI and look at the type of studies that we have funded. There is a summary of every research award that we have funded. So, and that's 700 of them. So you can go in there and really look at the different comparators, and also be aware that, one of the things that we do during the merit review process, and then our own selection committee process of determining which applications are going to be funded, we look to see, does this application also fill a gap? Like we're not going to repeatedly fund the same questions and the same type of comparative question, but it's like, does it help fill an evidence gap that's really needed by decision makers?
Thank you. I have a question. So this idea of engagement is still kind of a black box-ish, so I was wondering or hoping that you could maybe give a little bit more detail on what you would see as a robust engagement plan and one that, might satisfy PCORI reviewers.
Okay, so one of the things that we have done from our own learning is that we know that an application is not big enough to cover everything that would be conceptualized for engagement. In the application process, what we really are looking for is that the research team has carefully considered how they're going to engage people, why they're going to engage people, and how that really helps support the success of a study. One of the milestones of our awards of the contract is to submit an updated engagement plan, and that is a little bit more robust. That tool, again, is available on the website. You can take a look at it early before you even start thinking about drafting an application, to start thinking about, like what would be the goal associated with engagement. And I boil it down to, does it make sense? Why are you doing what you're doing? And I recommend that you go back to that slide that was, that does engagement make a difference? And so when you're thinking about your engagement activity, does it help the study become more feasible? Does it help make the study more acceptable? Does it help your study be more relevant? Does it help produce more useful and usable evidence? And if you can answer yes to that, then the activities actually kind of start falling into place. If you can't answer that, then it's, you need to spend some time thinking about, is the research that you're doing really going to benefit from engagement? And if not, we might not be the right funding mechanism.
Thank you.
Helpful?
Yes, thank you.
Okay, now I'm going to go a little bit a step farther of what I like to describe as about engagement, and what I like to just call the do's, O's, and ahas. And so these are just more relevant examples of it. So a do is that, like you're busy, your head's down, you're working on a research study, all of the details of a contract and setting up a study and dealing with all, the clinicians, getting it integrated, training your research assistants, right? That sometimes you miss some of the more obvious things. And so this example, I love, one of the interventions was an exercise program with older adults. They found no problem getting people to sign up to participate in the study. They found that retention just straight down. So they took that challenge of retention to their study advisory committee, which included patients and different stakeholders. And it was a patient that said, well, what music are you playing? The do, right? The answer was the research assistants. They knew that there needed to be music, so they were just putting on music that they liked, not thinking about whether or not the participants enjoyed the music they were listening to. So they made a real quick switch, let the participants start selecting the music, retention, no problem. So it's sort of like, you're looking everywhere for your glasses, you can't find them, and it takes somebody else to walk in the room and say, they're on top of your head, right? So that's what I call the do's. The O's are, a great example is clinician engagement. I kind of referred to this earlier with the federally qualified healthcare centers. We know that healthcare is a business. Clinics have operational standards in place. There's a flow of the work that takes place. So in order to integrate a study into that setting, you have to understand how that setting works and the constraints around what they can and cannot do to help make your study feasible. And so those are the O's, the clinician saying, or an administrator saying, well, this is how this works on a day-to-day basis. These are the things I cannot change and I will not change. I want to support your study, but in order for me to do that, in order for you to be able to collect data in this setting, you're going to have to figure out these things, how you're going to change the work you're proposing, not necessarily the study design or the questions, but how that work gets operationalized and carried out in order for it to happen here. The O's, very helpful, thank you. And then the ahas, those are the big moments, and oftentimes are the actual evidence themselves, or when people are looking at doing the analysis of data and recognizing, wow, there's a sub question that we can actually answer as a result of this data that we have. Aha, we have more knowledge now. So I hope that is helpful.
Thank you. Yes, we've had 2 more questions come in. Eileen Helen asks, can you speak about the process for resubmission? If your invited application is ultimately rejected, can researchers be successful the next time around with an improved version of an application that addresses the same issue?
Yes, we have had successful resubmissions.
Thank you. And she also asks, if someone is interested in applying for PCORI funding, do you think participation as a merit reviewer or as an advisory panel member would be a better learning experience in terms of gaining a better understanding of what is a successful application?
Merit review, absolutely, because you kind of get that insight of how the applications, what the process is, the type of things that reviewers are asked to score and rate. So yeah, and we do have a lot of funded researchers who serve on our merit review panels. The advisory panel, we do have people who received research awards as well as engagement awards who serve on our advisory panels. So yeah, being involved with PCORI is a great way to get closer to a successful application, and also learning about what really makes good, strong PCORI questions as well as study designs. One of the things too that I do recommend is, with the annual meeting now being recorded and available on demand, you can go in there and you can pull some of the panels and watch those panels, where it's the researcher and patient partners talking about their research and some of the challenges associated with it, the things that they've learned.
Thank you so much. I don't see any other questions have come in. I'd like to really extend my, most extreme gratitude for your being here today and providing such a wonderful overview of PCORI and engagement. And hopefully you'll be seeing more of us in your inbox.
That's great. That's great. Don't hesitate to knock.
Thank you so much.
All right, bye.
And
it's been a pleasure, everyone.
Everyone who's here, this has been recorded and will be available. Louisa can put it on our YouTube page and share the link. So thank you so much. Have a lovely weekend.
All right, bye-bye.